It's good evening where I am, but it may be good morning or good afternoon or good night where you are. So as Natalie mentioned, I'm the director of Child Safe Horizons, and we're a boutique consultancy firm specializing in child safeguarding and child protection in emergencies, as well as a range of other child protection fields. I've been working in the field of child protection for about 15 years myself, a large part of that in the field of helping organizations develop child safeguarding policies and procedures. So we'll go ahead and start. As Natalie said, if you have any questions that you want to raise, please feel free to send her private questions or to use the chat box, which should be on your right-hand side. If you have any issues such as not understanding what I said or not hearing me, please use the raise your hand button, which you'll find on the panel. If you look at the buttons, there's a red button, green button, and then two blue buttons to the left side of the panel. So just raise your hand if you have some sort of an issue, and you can type that issue into the chat box. So we'll go ahead and start. First of all, I'd like to go over the learning outcomes for this webinar. First of all, we would like to make sure that participants at the end have a clear understanding of the difference between child protection and child safeguarding. Secondly, we want to make sure that participants understand where child safeguarding fits within the Child Protection Minimum Standards, or CPMS. We want to make sure that participants understand how to apply child safeguarding in child protection and emergencies programming. And lastly, participants will be able to understand the importance of child safeguarding across all humanitarian programming. So many times people have heard the terms child protection and child protection policy, but child safeguarding and child safeguarding policy are terms that fewer people are familiar with. But there are some very important distinctions between these terms, and understanding the difference is as important as understanding what child abuse is and how it can be prevented. So in its widest sense, child protection is a term used to describe the actions that individuals, organizations, countries, and communities take to protect children from acts of harm, including abuse and exploitation. For example, domestic violence, exploitative child labor, commercial and sexual exploitation and abuse, physical violence, to name but a few. The term child protection can also be used as a broad term to describe the work that organizations, international or local NGOs, faith-based organizations, or UN agencies undertake in particular communities, environments, or programs that protect children from the risk of harm due to the situation in which they're living. So this is the term that most people are familiar with. It is broad and encompasses the entire field of what we would classify as child protection work. So using the chat box, can anyone give me some examples of child protection based on the definition that I've just given you? So any examples of child protection in the broader sense?
Are you all still there?
Okay, Natalie, I'm here.
Yeah, they're here. They're sending stuff through. Can you see what they're sending through?
No, I can't see that.
And Eric had a raised hand. Eric, yes? Can you hear us?
Yes, I can hear you. I think one example of child protection is having, for example, structures like child protection committees in communities, having regulations or policies in place as part of ways of trying to make sure that there is a reduction in violence or something, structures that can work towards ensuring that children remain safe, they are not abused at community level, or even laws and policies that also govern countries not to govern countries in order to ensure that the population do not abuse children. And in the case there is abuse, there are response mechanisms. I have a feeling that that's one of the examples.
Okay, yeah, so that's a good example. Child protection committees in communities, for example, community-based child protection mechanisms. That's a good example of child protection work. Can anyone else give me an example?
Can you see the question pane in the question box? There is a lot
No,
here,
I can't see.
so I'll let you know what they are.
Okay.
So we've got
Okay.
things like prevention and response. We've got prevention and response to unaccompanied children from Karen. We've got criminal record checks of staff involved in programs. So I guess that's where we'll cover child safeguarding very soon. Making children aware
Yes.
that abuse is not allowed. Staff training on the definitions and indications of abuse. That's from Jess. We have child-friendly spaces. We have developing child protection systems. Working with children associated with armed forces and groups, and another one about justice for children. So working with children that are associated with the law.
Yeah, so those are all good examples of what we would term child protection in the broad sense that I gave, with the exception of I think it was the example about checks for staff that we will cover under child safeguarding. So it's broad work in the community with either with specific groups of children, such as children at risk of or who have been recruited into armed forces, children who have been sexually abused or exploited, children working in communities, community-based child protection mechanisms. It's really the broader field of child protection. So the term child safeguarding will be new to many people. Increasingly, this term is being used specifically for inward-focused, business-specific policies and procedures which apply to the way in which staff, volunteers, and others interact with children they come into contact with. So it is a subset of broader child protection work, and again is focused on the policies and procedures which guide the way in which staff and others associated with an organization would interact with children, whether inside their programs or outside of working hours. So the takeaway points are that child safeguarding is internal facing, business critical policies, procedures, and practices that are employed to ensure that an organization itself, local or international organization, faith-based organization, school, religious institution, UN agency, etc., is a child-safe organization. So what do we mean by the term child-safe organization? To be child-safe, an organization needs to be actively implementing and monitoring the child safeguarding policies and procedures which the organization has in place. So this would include ensuring that all staff clearly understand and model the behavior that is expected of them when interacting with children. It means ensuring that regular training is provided for all staff and others associated with the organization so that they understand what constitutes child abuse, the importance of having a child safeguarding policy, and internal procedures for reporting any policy breaches. It means ensuring that child safeguarding is mainstreamed throughout the organization, including in risk assessments and mitigation. And it means making sure that the organization's child safeguarding policy and procedures are publicly available and that all beneficiaries are aware of what kind of behavior to expect and how to report any breach of the policy. And this includes children. So it means ensuring that any policy or code of conduct is also available in child-friendly language, translated into local languages, but also available in child-friendly languages, and that children themselves are made aware of the existence of the policy, the kind of behavior they should expect from staff, and where and how to report if any staff or others associated with the organization abuse them. So remember, when I use the term others, it refers to anyone who is associated with the organization. So a child safeguarding policy must apply not only to staff, but also to volunteers, consultants, contractors, vendors, suppliers, donors, study tour participants, media. Basically, anyone who is contracted or hosted by your organization needs to be covered by this child protection policy and its procedures.
Are there any questions at this
Before
point?
I go any further, are there any questions at this point?
We said it at the same time.
Are you getting any questions, Natalie?
No, I can't see any questions.
Okay, so we'll go ahead.
Let's just make sure. No, it's all clear. Everyone seems to be
Okay.
very clear on what's going on. Great.
Okay, so next we're going to look at where child safeguarding fits within the child protection minimum standards. So I want to check and make sure that everyone has a copy of the CPMS available. Is there anyone that does not have a copy of the child protection minimum standards available, whether hard copy or soft copy at this point? Okay, I'm going to assume that everyone has that copy. So using the CPMS, can anyone tell me, and use the chat section or the question section, what standards and principles relate to child safeguarding? So what standards and principles within the CPMS relate specifically to child safeguarding? Okay, Natalie, are you getting some examples?
Eric's got an answer for us. I'll just unmute him.
Okay.
Eric, can you hear me? Eric?
I raised my hand when I was actually indicating that I don't have it with me.
Okay. Oh, okay.
Yeah.
Sorry. Okay.
Yeah.
Okay, can anyone give me an example, looking at the CPMS, of what standards and principles might relate to child safeguarding, using the definition of internal facing, business-focused child protection policies and procedures to ensure that children are not abused by staff and others associated with the organization. Any examples, Natalie?
The Secretary General's bulletins is what has come up.
Okay.
Standard 2, human resources.
Oh, great. Okay.
That's from Joanna and from Karen. Standard 2.
Okay.
Avoid exposing children to further harm. Rahaf Safi. Did I say your name right? I'm sorry if I didn't say it right.
Okay.
Yes, I said his name.
That one was,
said their name right.
yes. Okay.
So yeah, that's true.
Okay.
Avoiding exposing children to further harm, and standard 2. So a principle and a standard. Yeah.
Yeah. So we'll go ahead and we'll look at a few more areas where child safeguarding fits within the CPMS. I think if you guys had all the answers, you wouldn't be on this webinar. So
yeah,
it's a good indication that you're in the right place right now.
And so Muriel and Eric don't seem to have a copy of the Child Protection Minimum Standards, so we'll resend that. We did send a link to it this afternoon, but we'll resend it to the both of you, so don't worry. Anne Fitzpatrick has said Standard 3 for media. That's great. Someone
Very good.
outside of the human resource standard. Yeah. Excellent.
Okay. So we'll move ahead and look at the principles themselves. I've just gotten an email from somebody that she's been trying to connect to webinar for 30 minutes. Okay. So for some people, it looks like their internet connection is not good enough. So there will be a podcast or, well, I don't know if that's the term, but there will be a recording of the webinar available afterwards. Okay, so going through the principles. Principles 1 to 4 in the Child Protection Minimum Standards are the protection principles in the Sphere Handbook. And they're restated in the CPMS with specific reference to child protection. So anyone who is working in the humanitarian field should know that the CPMS is the latest accompaniment tool to the Sphere standards and should be familiar with all of these principles already. So Principle 1, avoiding exposing people to further harm as a result of your actions, or is often known as do no harm. Principle 3, protecting people from physical and psychological harm arising from violence and coercion. Principle 5, strengthening child protection systems. And Principle 6, strengthening children's resilience in humanitarian action. So the standards to ensure a quality child protection response, there are 6 of them. Coordination, human resources, communication, advocacy, and media, program cycle management, information management, and child protection monitoring. And we'll go into these in a bit more detail and look at some examples of where these might, where child safeguarding runs through them. So in the standards to address child protection needs, child safeguarding policies should include definitions for every form of child abuse, neglect, and exploitation that you see here. So we have Standard 7, which is dangers and injuries. Standard 8, physical violence and other harmful practices. Standard 9, sexual violence. Standard 10, psychosocial distress and mental disorders. Standard 11, children associated with armed forces or armed groups. Standard 12, child labor. Standard 13, unaccompanied and separated children. And Standard 14, justice for children. However, so while child safeguarding policies need to include definitions for each of these, the child protection issues and risks found in Standards 7, 8, 9, 10, and 12 are most likely to be found within an organizational child safeguarding policy. So standards to develop adequate strategies. Even if your organization is not implementing or you channel programs through community-based groups, organizations, or local NGOs, it is critical that you look at the organization's child safeguarding capacity. And Child Safe Horizons has a checklist and a tool for helping you do this. It is critical as your organization, as a donor or a partner organization, has a responsibility to ensure measures are in place to support the protection of children at that field level. So can anyone give me some examples of what child safeguarding might look like in, for example, case management or community-based mechanisms, child-friendly spaces, or protecting excluded children? So starting with case management. Can anyone give me an example of where child safeguarding might come into play? Natalie, are you getting some examples?
No, not for case management.
Okay. So case management, one example.
Wait,
Yep.
we're getting some now. It just takes a little bit of time for it to come through.
Okay.
Ensuring confidentiality, two adult rule during a follow-up of cases. That would be specifically for external cases in community where organisational staff are not involved, once someone said. So that's interesting.
Can you read that to me again, Natalie?
That would be specifically for external cases in community where organisational staff are not involved. So can I ask if organisational staff are not involved, are you paying that other sub-organisation to do that work, Muriel? Or is it just, are you not involved in case management at all? From a financial or contract sense? Where's Muriel? Let me put her on off the... Let's see if we can get her to speak. Muriel, are you there? I'm just taking you off.
But I was muted.
Yeah, sorry.
Hello, good morning. So the way we do it here in Lebanon is that we treat internal cases differently through child safeguarding focal points from external cases in community where we have case management teams. So this is what I mean, where we make a difference in all of it is child safeguarding, but we make a difference in how we handle it, because situations and cases that we encounter which are directly from community, in community, where it's not like one of our staff doing the harm to the child, but it's completely external and it's not even one of our beneficiaries being harmed. This we treat, we call it as an external case, and this is handled through case management teams. So this is what I meant. So child safeguarding, the real child safeguarding cases, if we can say, are mainly for internal cases where one of our staff members or other type of representative is doing the harm.
Okay, so Muriel, what if one of the case managers was a child abuser and you didn't know? What procedures have you got in place for these external people to protect the kids that they're case managing?
Well, actually, it's not external people that are doing it. It's our own staff.
Okay.
Our staff, our personnel we have case management teams within Save the Children staff.
Okay.
This is what I mean.
So they would be covered by your policy.
Sorry, it's part of our child protection work.
But they would be covered then by your child safeguarding policy, no?
Sorry, again?
The staff would be covered by your child safeguarding policy, no?
Yes, exactly.
Yeah. So
it's our own staff who is well aware of our child safeguarding policy,
yeah,
and who is, and of course, but who is working for child protection programs.
yeah.
And we have then a specific child case management, let's say, focal point, who takes the lead on these cases when these cases come up.
Okay,
So
so
it is the
Muriel,
safeguarding staff. It's not an external party dealing with it. But the case, we call these cases external in the sense that they are happening in community, and the abuser is not, or the potential abuser is not one of our staff.
So why would the potential abuser not be one of your staff?
It's when it's clear that it's, for example, a family member, or
Yeah.
you know, it's when we have the case, we know it's not one of our, if it was someone of our staff, then it will be an internal case, and it would be handled by the child safeguarding focal point.
Okay.
So we make a differentiation. So case management is part of our child protection activities.
okay, so to clarify, what I was asking is, okay, so if we think of child safeguarding, if we go back to the idea of child safeguarding as business-focused, internally facing, and child safeguarding covers your staff and anyone associated with your organization.
Yeah.
Can you give me an example of how child safeguarding, how it would appear in case management programs? That's right. So how child safe, you think it wouldn't? Okay.
No, in our case, it wouldn't. We handle it differently from, we don't call that case management. Well, it is a management, of course, of a case, but it's like a child safeguarding case, whereas what we simply call case management within child protection is those cases of abuse which are completely outside the organization.
I think you're misunderstanding what we're asking, Muriel. So
I'm not. Yeah, that's the thing. I'm not completely following.
Okay,
maybe.
so
okay.
you're talking about cases in the community where the abuse has occurred, and a case manager will deal with that. When we're talking about a case management program, we're talking about staff, we're talking about resources, like they might have notebooks and things like that. You might have to train them. So there's a whole range of things that you have to do with those case managers. What we're talking about is, how do you minimize the risk to the clients from your case managers? How do you minimize the risk that that internal abuse will occur? So you've got your child, you've got your Save the Children safeguarding policy, that's one thing, but do you have anything else in place to minimize the risk?
Yeah, so what we do systematically, sorry, because I see maybe this as basic, sorry, but regularly every new staff.
Don't apologize.
No, sorry, sorry. Every new staff or volunteer, even down to volunteer and including also daily workers, at different levels, get an orientation to begin with, and like minimum 1 hour. And then we, you know, and this is a live orientation, not the online course or anything. We have a live orientation. And then at one point, within 6 months or so, we, if not earlier, we are giving a full day training. So all staff and volunteers, even teachers, because we have a lot of teachers who work directly in schools which are not even coming to our offices, you know, and other volunteers which are not in our offices, they regularly also attend those, like a training at one point, Yani. But the minimum is that they have the introduction of an induction of 1 hour.
Yes.
About child safeguarding specifically. Yes. And they, of course, sign the policy, and we have our, for example, for teachers, our education assistants would follow up on and to observe what's going on in the field.
Yeah.
Okay, thank you.
So
Thanks for that. So can I give you some of the other comments, Karen, in the question box? Thanks so much, Muriel. And that was great.
Yeah, thanks for that. And I want to remind everyone that, again, we want you to look at the child protection minimum standards. So when we're talking about case management, look at the child protection minimum standards and what it says in there about case management.
Okay, so we have background checks from Jacqueline, and we have for the case managers, and we have
Okay.
implementing a code of conduct from Philippe, which is what Muriel was also talking about,
Yeah.
and having a detailed reporting and responding system in place also from Philippe. Yeah.
Okay, and I think I heard earlier also confidentiality of
ensuring
the
confidentiality
information.
and two adults in a follow-up case.
That's great. Okay. So what about standard 16, community-based mechanisms? Can anyone give me an example of where child safeguarding might fit within this? So community-based child protection mechanisms, child protection networks. Are you getting some examples, Natalie?
No, it takes some time for them to come through.
Okay.
Nope.
Okay.
They've all gone
So with
quiet.
community-based mechanisms, you know, again, it's you know, it could be something such as ensuring that everyone has a clear and common understanding of the terms that are used, such as child abuse, corporal punishment, making sure that the message of no violence against children is communicated clearly, background checks for staff, making sure that children are also able to voice their concerns and participate. Standard 17, child-friendly spaces. Any examples?
So Muriel
Child
just
safe
put an example around around the network that they have, and organisations that are specialised in psychosocial support, medical services, and referral systems, basically.
Mm-hmm.
Yes. And now in child-friendly spaces, what can people think of? Setting up a complaints mechanism, setting up a way for children to report. That's from Karen. What else? Complaints boxes. Oh, I like that, Muriel. That's good.
Mm-hmm. Making sure that there are no adults coming into the center that shouldn't be there.
Yes.
Making sure that you do background checks of volunteers, and it may not be necessarily police background checks, that may not be possible, but at least, you know, checking with other community members, because often child-friendly spaces, you know, it's good practice to try and use existing groups that may be there, or volunteers or individuals. So looking specifically at child-friendly spaces.
Someone also said staff-to-child ratios. Making sure that they're okay.
Staff-to-child ratios.
And also signing children in and out. So making sure that not just anyone can pick them up.
That's right. Very good examples. So child-friendly spaces is one where humanitarian organizations often get feedback on from donors and partners. So any other examples of what child safeguarding might look like in a child-friendly space program? The examples that we have here are that each child-friendly space has a child safeguarding policy, and it is available for parents, carers, and children to see. So it's really not enough for organizations to say, oh, yes, we have a policy. It's very important. Organizations need to realize that many times beneficiaries don't know that an organization has a policy. They may may assume that an organization has policies, or assume that they do background checks, but it's important that beneficiaries understand that they do that, and that includes children, as I mentioned before. It could include positive discipline training for the volunteers working in the child-friendly space.
Eric has raised
could
his
include
hand, Karen. When you get a chance, I've put him off mute. Eric, are you there?
Okay.
Did you have something to add?
Yes. Yeah, I was saying that in most cases also children, since we are dealing with a number of children,
Oh,
then we need to have an adequate number of staff that will be in position to take care of the children. Like, for example, if our children are 25, you can't give them just to leave them to one staff. And two, in most of the communities, like in this part of the world, in the Middle East, you can't say that now girls are left under the care of male animators, for example, the child-friendly space. So gender is also taken into consideration.
yes, thanks for that input, Eric.
Yeah, that's correct. So training on child protection for all staff and volunteers, and that training needs to be contextualized and specific to the context. In some settings, it may be appropriate to include prayer or some form of religious services in the child-friendly space, and others it may not. So, you need to look at the context, whether it's gender issues, issues of touching. For example, the example, with Ebola, was that there needed to be a rethink on how child-friendly spaces operated in order to keep children safe from contracting Ebola. Training on the child safeguarding policy and code of conduct, including how to report. So many times we hear of organizations providing training to their staff and that all volunteers and staff sign the code of conduct, but when you actually go and talk to staff or volunteers, they say, oh yeah, I think I signed something when I joined, or I signed a lot of pieces of paper, and I think that code of conduct was one of them, but they can't actually recall that for you. So it really needs to be front and center for all staff. When I was helping organizations develop child safeguarding policies in Australia and Papua New Guinea, one of the recommendations that I made was that the organization make sure that the code of conduct is posted in, like, for example, in the kitchen or the staff room, and also in a place where the public could see it, so at the front of the office. It's very important to keep this front and center. It could also be included as a regular agenda item in monthly staff meetings. The policies need to be reviewed on a regular basis. Okay, so Muriel, I think, had a comment. I don't see that. Natalie, did you want to?
Yes, so Muriel said that they can certainly do more in Lebanon for beneficiaries to really understand and know what behaviour they should expect from staff and how to report abuse. And I don't think Lebanon's unique in that way, Muriel. I think there's a lot of places in the world that we could do more from that perspective. Yeah.
Absolutely. I mean, I think that we know that from what we are hearing, for example, cases that have been coming out in the field from Central African Republic and others where children have been abused by humanitarian staff, that in many cases the children who are being abused did not know where and how to report. Community members do not know where and how to report. And it's important for humanitarian workers to remember that they hold power over the communities they work in because they have access to resources, to potential funding, and so it's important to understand that power imbalance is a part of potential child protection risk. So I'm going to move on now, and we'll look at mainstreaming child safeguarding. But at first I wanted to talk about mainstreaming within the standards themselves and not just the other sectors. So this is looking at the part of the CPMS. It's called the Standards to Ensure a Quality Child Protection Response. So for example, coordination is the first one. A coordinated response will ensure that all children are equally protected and that no children are left out. Aspects of human resources, such as training of staff and background checks, these are critical to child safeguarding. When we look at communication, advocacy, and media, these systems must also include child safeguarding procedures, such as protecting the identity of children, images which emphasize children's resilience and do not show children as victims. Child safeguarding, when we look at program cycle management, child safeguarding must be a part of program cycle management, such as in program design, ensuring child protection risks are included in risk management, monitoring to ensure procedures are being followed and risks are not changing over time, and evaluation. So policies need to be reviewed every few years or when the situation demands. So for example, if conflict breaks out or there is some other change in a situation, the policy may need to be reviewed. Information management. During an emergency, unaccompanied and separated children need to be identified and, if possible, family members traced. And then there's case follow-up in the aftermath, and child safeguarding means ensuring the confidentiality of all information which is gathered. And finally, monitoring child safeguarding at all times. So looking at the standards to mainstream child protection. So I am hoping that all of you would be able to provide clear and concrete examples of how child protection can be mainstreamed throughout all humanitarian sectors. Okay, so Jacqueline has asked us to talk about those who work through partners. So I think that could probably be a whole separate webinar. And I realize that a lot of humanitarian organizations work through partners. I think it's important that humanitarian organizations begin to look at their own procedures first and then begin to look at their partners. One thing that organizations I have done have implemented in terms of working with partners is developing partnership agreements and grant agreements, which include a reference to child protection standards. So this is one way to make sure that partners understand that they are expected to abide by child protection standards. Another way to do this is tools to assess the risk that partners may pose. So, for example, an audit of their current child protection situation, whether it's the capacity or the situation in which they work. Having staff, partner organizations sign a code of conduct. Although Child Safe Horizons takes the approach that we encourage organizations to help their partners develop their own child safeguarding policies, rather than just handing your organization's policy to your partners and having them sign that. The reason for this is that partners come at programs from their own point of view, whether it's cultural, religious, faith-based, and programmatic, and it's important that partners take ownership of the policies as well. But your organization still has a duty of care to the partners in helping the partners understand what child safeguarding is and develop policies. And your organization also has a duty of care to strengthen and support partners. So I want to move on to looking at the standards to mainstreaming child protection. So all of the sectors that are listed have child safeguarding mainstreamed throughout them. So it's important to remember that we're still focusing on child safeguarding rather than protection. So any examples given should have some element of keeping children safe from abuse, neglect, and harm, particularly that which is committed by staff or others associated with the organization. So using the chat box, can somebody give me an example of child safeguarding in education programs? We'll wait a minute for examples to come.
So we have child safeguarding in each of their program sectors. So child safeguarding focal point in each of their program sectors across Save the Children, including education. One of the examples given by Jacqueline is positive discipline. Muriel has also said that they give a one-day training on child safeguarding to partners, which is really extraordinary. That's great. Any others?
So again, when I'm talking about these
giving positive
sectors
discipline
here,
training to staff and families, teacher trainings on positive discipline, report mechanisms for children, teacher to child ratios, not allowing teachers to be left alone with closed doors in a room. Yeah.
What about health in the health sector? Can anyone give me some examples of mainstreaming child safeguarding in the health sector?
Always having a partner, nurse or something in the room.
Yeah, or it could be the parent or the caregiver.
Yeah. The example given here was a nurse. So having two people in the room all the time. Screening of staff.
Training healthcare workers to identify signs of abuse in children. Okay, what about water, sanitation, and
following
hygiene?
a code of conduct for taking medical pictures.
Very good. Okay. Okay. So what are about WASH, or water, sanitation, and hygiene? Any examples of how child safeguarding can be mainstreamed in that sector?
Ensuring suppliers aren't using exploitative labour.
Yeah, that's a good one. So making sure, so remembering that the child safeguarding policy applies to suppliers and vendors as well. So your organization, if you contract suppliers or vendors or truck drivers or guards, you will need to monitor those individuals as well and make sure that those individuals also understand that you have child safeguarding policies and procedures, and that their services are not exploiting children. Another example is that all girls and boys should have access to WASH services in a way that minimizes the risk of sexual violence, including from staff. So making sure that there is proper lighting in the camps. We talk about this in the context of gender-based violence, but many times it is often children who are the ones who are expected to go and collect water, and in that case,
so Jess has put that ensuring placement of WASH facilities is safe for children to access at night. So it's aligned with what you're saying, Karen.
That's right. That's right. Another example is just having smaller buckets of water, for children to carry water in. So in one refugee camp that I did some work in, one of the complaints was that there were only large buckets and it was difficult for children to carry those. And children often want to help their families, but they can't carry these large buckets. So perhaps providing smaller buckets for children to carry so that they don't hurt themselves or fall down. Okay. What about camp management? Any examples? So camp management of refugee camps, internally displaced persons camps. How can we mainstream child safeguarding?
So placement of the various lights and wash facilities is what is here.
Mm-hmm.
Placement of where the education facility is, so it's not an isolated place.
That's right. Child safeguarding, you know, screening of any staff that are working in camp management, making sure that child safeguarding policies and codes of conduct are in place. In some camps, refugees themselves may be in charge of the running of many programs, in which case the child safeguarding policy and procedures need to apply to them as well. And making sure that there are clear reporting mechanisms for any violations. And lastly, in terms of distribution, an example would be ensuring that children are protected from physical harm. So, for example, making sure they don't have to carry heavy loads, that child-headed households receive assistance during distribution, and that there should be clear child safeguarding policies and codes of conduct in place for all staff. So maybe I need to give a more specific example, and I can give an example from one that I know from the field. There was an organization that I worked with. It was a partner organization in a different country, and they worked in a refugee camp, and they contracted drivers to deliver supplies in and out of the camps. The organization's staff were covered by its child safeguarding policy and code of conduct and received training. But on one occasion, there were two children in their teens who decided they wanted to go outside the camp and hitched a ride with a driver. The driver ended up taking the children to a hotel and threatened both children, and then took the child to a hotel room and raped her over a series of days. Luckily, the children were able to afterwards report the case to another organization, and it was reported to the police. But ultimately, the duty of care came down to the organization that hired that driver, because it was that driver that committed the abuse. So quickly, the organization had to fill the gaps and had to make sure that all the drivers and contracting companies that hired drivers were training their drivers in the child safeguarding policy and making sure that they understood that everyone was responsible for making sure that children are kept safe. So going over the importance of having a child safeguarding policy, there are moral reasons, obviously, for having a policy which is protecting children from abuse. There are organizational reasons, such as ensuring that job applicants are properly screened and child abusers are not hired. And for those who work in humanitarian settings, having a child safeguarding policy and procedures in place is a part of a do no harm approach. So it really should not be a very foreign concept to those of us working in the humanitarian field. So child safeguarding is important in all humanitarian settings. Child safeguarding policies help staff help all staff to understand what is right and wrong behavior with regards to children. A child safeguarding policy helps staff and beneficiaries report any concerns and ensure proper follow-up. And it is a key component of good HR practice and organizational transparency and accountability. And increasingly, it is becoming a requirement of donors. So, an important note is that even if your organization does not yet have a child safeguarding policy, remember that there are other international child safeguarding commitments that exist. These include the UN Secretary General's bulletins and a statement of commitment, which have been signed onto by 20 UN entities and more than 24 non-UN entities. So, important points to remember. What I'd really like all participants to take away is that child safeguarding can and must be incorporated into humanitarian programs. By the very nature of the settings in which humanitarian agencies often work, they work with extremely vulnerable populations. And it's therefore very important that humanitarian programs include child safeguarding measures. It is a myth that only child-focused programs need to incorporate child safeguarding measures because children are everywhere. And children are particularly at risk of abuse and exploitation from staff working in humanitarian programs, as the situation is often chaotic. There may be large numbers of separated and unaccompanied children who are at greater risk, and access to vital resources can give humanitarian workers a huge amount of power and influence over children, their families, and communities, and this influence can be abused. So, are there any questions? Or, Natalie, were there questions that were asked during the webinar that you want to cover?
No, I think we got all the main technical questions, but if there's any more, please write them now. There was a comment around resources available to develop these policies, and someone has written they'd greatly appreciate your recommendations, Karen. So maybe you can talk about what's available.
Okay. So, Child Safe Horizons is available for various consultancies related to child safeguarding, child protection, and emergencies. So we have consultants who are experienced in working with a range of organizations in a variety of program contexts and across cultures to develop robust policies that will protect children, staff, and organizations. So we can work closely with your organization utilizing global best practices and tools which have been tried and tested over many years. At the same time, we will tailor a policy and training approach to the particular needs of your organization. We are dedicated to building the capacity and skills of organizations in child safeguarding in order to ensure that staff members will feel confident in their work, ensure organizations remain accountable to beneficiary populations, but most importantly, to ensure that all children who come into contact with those organizations are protected from all forms of abuse and exploitation. So if you have any other questions, you can visit our website. I believe our intention is to provide further webinars such as this, but from now on, they may not necessarily be free. But as I said before, we have a variety of tools and many decades of experience between us in this field. And it's important to reiterate that it's really not necessary to reinvent the wheel. There are a lot of tried and tested tools and training resources that are available, and Child Safe Horizons can help you identify these. So before we finish, any other questions or comments?
So there was a few comments. One is they'd like specific training on how to work with partners. That was Save the Children in Lebanon. so Eric has suggested that the PowerPoint is shared alongside the recording of the webinar. Eric, I think that's the plan. The Child Protection Working Group was really lucky because we did most of you would know, we did a very large survey monkey on needs for webinars, and this was one of the biggest areas where people wanted more information. So we were lucky to convince Karen to do this for us, and we really appreciate Karen's time because she's a very busy lady. But we will definitely be sharing this recording of this webinar if it works, because this is the first time we've used this particular software because we had such a overwhelming response. So we wanted to make sure everyone could be part of it. So yes, we'll be sharing the webinar and we'll be sharing the PowerPoint. And there's a question around, do you recommend partners to have their own child safeguarding focal point? So I
Yes,
think Muriel's
absolutely.
talking about partners of these bigger organisations because she's working for Save the Children. So I'm assuming it's her partners.
Yeah.
And the overwhelming answer would be yes for that, right? Like we
Yes,
would
that's correct.
recommend across the board, just like in the minimum standards, that they would have a child protection policy, that they would have training, that they would have all these different measures. And there is a tool that Child Safe Horizons uses to assess organisations, and it also has recommendations on what you can do to strengthen that organisation if it's got a high risk.
Yep, that's correct. Natalie, our recommendation is that any agency which has a child safeguarding policy has a child protection focal point in each location. So not only one for the organization, but actually one in each location.
No, but I think they're even talking about their partners, their sub-partners.
That's right, that's right. But any partner, any sub-partner should ideally have their own policy.
Yeah.
So they may follow the Save the Children policy, but ideally they would also have their own policy, which is in line with the Save the Children policy, but is developed by the partner themselves.
Yeah, right.
It's really the process of developing the policy that is just as important as the policy itself.
And given that we work in places, particularly across the Child Protection Working Group, where the capacity is not always so high and it's quite a challenge, would you recommend that this be part of, when you're developing a project with a partner, that you look at how you can strengthen their child safeguarding as part of the project development?
Absolutely, and many donors actually require this. So you may not be able to provide funds to a partner if they don't already have a child safeguarding policy in place. So if that is the case, if they don't have a child safeguarding policy in place, you could apply, have them apply your policy in the interim, but include, for example, in their project budget, funds for training for their staff to develop their own policy.
Okay, great. That's clear.
Yeah.
So thank you so much, Karen, for your time. We really appreciate it. And thanks, everyone, for your time on the call. We will be sending this out very soon, the recording of this, and we really appreciate the participation and the questions. It was really fantastic.